Porphyrin, hem, and biopigment are fundamental to metabolism. Heme has special function in oxygen transport and electron transfer, and also detoxification of the cytochrome P450. Any disruption to this pathway can lead to clinical blood and liver disorder. This diagram shows the synthesis of heme and degradation from the bilirubin to bile. This presentation will focus on biochemical pathway of heme synthesis and the degradation. It also shows why porphyrin are fluorescent and how defects in these pathway explain porphyrin jaundice. This picture shows the regulation of heme synthesis in the mitochondria. Porphyrin and heme and biopigment. The biochemistry of porphyrin and biopigment are closely interconnected. Heme metabolism connects porphyrin synthesis to biopigment formation. By understanding this pathway, it is important to distinguish between the normal physiology and disease state. The image shows the flow chart linking the red blood cell production. A heme process primarily occurs in the bone marrow, and the secondary site of the red blood cell and heme production are in the liver and in the spleen. The structure of porphyrin. Porphyrin compound contain 4 pyrrole rings connected by methane bridges. The porphyrin ring contain nitrogen atom, capable binding metal ion in the hemoglobin, and the magnesium binding nitrogen in the chlorophyll. This image shows the porphyrin ring chemical structure of the ion porphyrin with the heme in the hemoglobin and the magnesium porphyrin in chlorophyll, which help with the photosynthetic pigment in the plant. The heme synthesis. There are 85% of heme synthesis occur in the erythroid precursor cell of the bone marrow, where hemoglobin production is high. The rest of the heme synthesized in the liver hepatocyte supporting hepatic homoprotein. Example, cytochrome 4 P450. Heme biosynthesis begins in mitochondria. Heme is synthesized from the porphyrin combined with the iron. Begin from the succinyl-CoA and glycine to form the ALA or the 5-aminolevulinic acid. This reaction is catalyzed by the ALA synthase enzyme and vitamin B6. This picture shows the heme synthesis pathway with cellular compartment within the mitochondria. Heme protein perform essential function for cellular respiration, metabolism, and oxidation and detoxification. So the hemoglobin function is for oxygen transportation. Hemoglobin in the red blood cell. And the myoglobin, the function is for oxygen storage, myoglobin in the skeletal and cardiac muscle. And the cytochrome C, it's transport electron. And the cytochrome P450, the function is for oxidation and detoxification reaction. This diagram showing hemoglobin structure and function of both hemoglobin and myoglobin. Hemoglobin in the red blood cell and the myoglobin here in the skeletal and cardiac muscle. The porphyrin that have color and fluorescent, they have conjugated double bond to absorb the visible light, which make them color and fluorescent, which is a special property to use in photodynamic cancer therapy. So this picture here shows the porphyrin with the UV fluorescent image, and it illustrates the photodynamic therapy or photothermal therapy and the chemotherapy, the treatment of cancer. Porphyria caused by abnormality in the enzyme activity of heme biosynthesis pathway. The clinical classification of porphyria, including the erythropoietic porphyria, which primarily affects the bone marrow. This often associated with the erythroid precursor cell, and the hepatic porphyria primarily affects the liver, which commonly involve dysregulation of hepatic heme synthesis. This picture shows the sign and symptom of porphyria and the treatment. Some drugs can cause porphyria, and some drugs are induced cytochrome P450, which increasing hepatic heme demand. This can cause excess accumulation of heme, which increase the precursor of ALA, delta aminolevulinic acid, and PBG that are toxic. The treatment. So this picture has the flow chart of treatment with metabolic management and liver transplant. In case of acute hepatic porphyria, the treatment including the intravenous of heme, a form of heme, to repress ALAS activity, which can reduce the toxics quickly. The heme catabolism, the breakdown of heme, there's about 200 billion erythrocyte breakdown every day, where the iron-free porphyrin portion of heme is degraded. It mainly occurs in the reticuloendothelial cell of the liver, the spleen, and the bone marrow. Heme oxygenase enzyme convert heme to biliverdin and bilirubin while releasing iron and carbon monoxide. So this picture here illustrates the heme breakdown, which convert to the biliverdin and bilirubin and release the carbon monoxide and iron in the process. Bilirubin transport and metabolism. So the unconjugated bilirubin bound to albumin and transport to the liver. Metabolism of bilirubin occur in the liver and secrete through the bile. So this picture here shows the bilirubin metabolism in the liver and the excretion into the bile. Jaundice result from elevated bilirubin level and become clinically visible with level exceeding 2 to 3 milligrams per deciliter. Causes include excessive bilirubin production or impaired hepatic excretion due to liver damage. So this picture here gives the background of bilirubin and the cause of jaundice. In the neonatal jaundice is caused by increasing hemolysis and immature hepatic system to manage the bilirubin uptake, conjugation, and excretion. It is a genetic disorder in the Crigler-Najjar syndrome, which can be very severe congenital jaundice, where the serum bilirubin level is exceeding 20 to 25 milligram per deciliter, which is very dangerous for baby. It can cause due to the complete absence of hepatic UDP of the glucuron salt transferase activity, which this disease can lead to brain damage, high mortality, and most baby did not make it within the first 15 months of life. The treatment usually is the phototherapy to help to reduce the bilirubin level for newborn. This picture illustrates the neonatal phototherapy image. In summary, heme synthesis and degradation are tightly regulated. Porphyrin structure explain color and fluorescence. Enzyme defects cause porphyrin jaundice. Bilirubin metabolism is essential for clinical diagnosis. These pathways link biochemistry to disease. And here are the interactive review questions. And this is the AMA references. Thank you for attending my presentation.